Hello, my name is Alex Ford and I'm a Professor of Gastroenterology in Leeds in the UK. I'm delighted to have been invited by Professor Omar to deliver this gut video entitled Predictors of Response to Low-dose Amitriptyline for Irritable Bowel Syndrome and Efficacy and Tolerability according to subtype, post-hoc analyses from the ATLANTIS trial. So, what do we already know about this subject? Well, in a previous meta-analysis published in this journal, tricyclic antidepressants were superior to placebo in the treatment of IBS. You can see from the forest plot that the relative risk of remaining symptomatic was significantly lower with tricyclic antidepressants compared with placebo when data from these 9 trials were pooled, and that effect estimate has remained relatively stable across multiple updates of this meta-analysis. However, these trials have limitations which include the fact that some were conducted over 40 years ago, they use historical definitions of IBS and historical endpoints to judge efficacy, they also use a variety of tricyclic drugs, and some use doses of these that are in the range to treat depression. In addition, most trials are small and underpowered, and all were conducted in secondary or tertiary care. ATLANTIS was a definitive, randomised, controlled, parallel group trial comparing 6 months of low-dose amitriptyline as a second-line treatment for IBS with placebo in patients with Rome 4 defined IBS in UK primary care. The trial met its primary endpoint in terms of the change in symptom scores on the IBS severity scoring system at 6 months with amitriptyline versus placebo. It also met its key secondary endpoint with amitriptyline being superior to placebo for subjective global assessment of relief of IBS symptoms at 6 months. Despite this, there were unanswered questions. These include what predicts response to tricyclics, as previous trials have been too small to examine this, and an individual patient data meta-analysis of existing trials has never been conducted. Are tricyclics effective in IBS irrespective of IBS subtype? And do tricyclics have more side effects in those with IBS-C, IBS-M or IBS-U, given constipation can be a side effect? So we set out to examine this, and I'm now going to present the new findings. In post-hoc analyses, we identified consistent predictors of response to amitriptyline, including age over 50 years, male sex, higher index of mean deprivation, presence of IBS with diarrhea, and higher levels of extraintestinal symptom reporting on the PHQ-12. This was found for the mean change in IBS SSS scores, subjective global assessment of relief, and a 30% or greater improvement in abdominal pain. Amitriptyline appeared effective for almost all symptoms of IBS, irrespective of IBS subtype, with individual symptom scores favouring active drug for all items other than abdominal pain frequency in those with IBS-M or IBS unclassified. Rates of constipation and diarrhea were the same with amitriptyline and placebo in patients with IBS-C, and you can see this on this butterfly plot here. And this was similar in patients with IBS-M or IBS unclassified. However, rates of constipation were higher with amitriptyline in those with IBS-D, whereas rates of diarrhea were higher with placebo. So how might this impact on clinical practice? Well, we have identified consistent predictors of response to amitriptyline, which suggests there are patient subgroups in whom efficacy is enhanced. We have also shown that amitriptyline was effective for almost all IBS symptoms across all subtypes, and bowel symptoms did not worsen in one subtype. Finally, amitriptyline was well tolerated irrespective of subtype. It would therefore seem reasonable to offer amitriptyline as a second-line therapy to patients with IBS irrespective of their subtype. The trial was funded by the National Institute of Health and Care Research in the UK, and it's important to point out that the views expressed here do not necessarily reflect those of the Health Technology Assessment Programme, the NIHR, the NHS, or the Department of Health and Social Care.